Hey, it's Dr. Jamie, and let me tell you about some amazing beef products that we love in our house. Certified Piedmontese is a healthier beef option that doesn't sacrifice flavor or tenderness. The cattle at Piedmontese are raised responsibly and carefully on family ranches across the Midwest, and they're healthier too. They're never given antibiotics, steroids, or hormones. They raise the rare Piedmontese breed through a ranch-to-fork approach that ensures traceability, environmental sustainability, humane animal handling, and responsible resource management at every step. Countless well-known chefs from across the country rave about the exceptional quality and flavor profile of certified Piedmontese beef. The Certified Piedmontese program is a source-verified ranch-to-fork operation that's rooted in dedication to the land, ranchers, cattle, consumers, and products. Progressive ranching protocols such as the electronic identification tagging technology, database tracking initiatives, DNA testing to confirm heritage, and voluntary third-party audits ensure the beef meets the high standards of care, handling, and quality. Certified Piedmontese beef has fewer calories, less fat, and higher protein per ounce than beef from any other breed, making it an ideal source of lean protein for a healthy diet. A serving of certified Piedmontese beef has even fewer calories ounce for ounce than salmon, yet it challenges the prime-grade beef products in tenderness. The combination of leanness and tenderness results in a consistently healthy and delicious dining experience for those who will not settle for anything less. And, well, you guys, that's me. So go check out Certified Piedmontese. They have a Dr. Fit and Fabulous beef box, or you can order any of their products using my code DRFIT, DRFIT. Thank you, Certified Piedmontese. Welcome to the Fit and Fabulous podcast with Dr. Jamie Semen. Hey everybody, it's Dr. Jamie. Welcome back to the Fit and Fabulous podcast. It's so awesome to have you here today. Well, I want to introduce you to today's guest, Michelle Hurn. She's known on Instagram as Run, Eat, Meet, Repeat, and she is a registered dietitian and ultra runner. Michelle was formerly a high carb distance runner and now has been improving performance and reducing her mental health issues, including anxiety and depression, by prioritizing protein and fat in her diet. She published a book that I think is absolutely amazing called The Dietitian's Dilemma: Advocates for Low Carb and a High Meat Diet. And I cannot wait to discuss it today. Michelle, welcome to the Fit and Fabulous podcast.
Hey, thank you so much for having me on. I'm honored.
Well, it's such an interesting story to have a dietitian here on the podcast, because this seems to be something that's somewhat controversial in the nutrition world. And I, unlike a lot of my colleagues, had training in nutrition before I went to medical school and sat through lots of classes with registered dietitians. And to this day, some of my colleagues still think what I do is, somewhat quackery. So I love the title of your book, The Dietitian's Dilemma, but tell us just a little bit about your story and how you ever, got to the point of even writing that book.
Yeah. So I'll try to give you the Reader's Digest version. So kind of my health journey starts when I was 12. When I was 12, I was diagnosed with anorexia nervosa. I was about 5 feet tall and 57 and a half pounds. So I went to inpatient treatment for 2 months. I was given about a 10% chance of survival, heart failure, kidney failure, everything kind of shutting down at that point. And that was actually my first interaction with a dietitian was at the treatment center. And I was put on 24-hour tube feeding, fed the standard American diet. And I did become weight restored at that point, but I was also put on 7 different medications as a 12-year-old, anxiety, GI issues, depression, racing thoughts. And I was told at that time, when I left the treatment center, that these were issues I would have my entire life. You're just going to have to be this high functioning person with anxiety and with, you'll probably always obsess about food, basically I was told I was going to struggle. And so I went, and that was true. I went through my early adolescence and into adulthood and, constantly had issues with depression, anxiety, raising thoughts around food, but I knew nutrition was powerful. I had seen it take me from almost dying to once again being able to, go back to school. I became an athlete. And so I wanted to become a dietitian. And so, to become a dietitian, you get your 4-year degree in dietetics, and then you have to get into an internship. So when I got into the internship, things didn't make sense. Like, and you're a student. So I would just ask questions. We would see a patient with type 2 diabetes. And, when you have type 2 diabetes, you basically have a carbohydrate intolerance. Your body can no longer correctly process and utilize carbs. So we would go into the room and my preceptor would say, okay, we're going to teach these people how to eat carbohydrates in consistent doses and then give them medication. And I'd say, oh, wait, what? Wait, shouldn't they just eat less carbs? And oh, no, Michelle, I was taught that every disease state, from diabetes, kidney failure, obesity, we all have to follow the nutrition guidelines, which is very heavy on carbohydrates, specifically those quote unquote healthy whole grains. But I'll never forget going to the ICU as a student and flipping over the tube feeding bags. And I'm like, oh my God, look at the ingredients of this. At that time, I was 25 at that time. I was like, this is the same stuff I was fed as a 12-year-old, the number one tube feeding ingredients. And if you're tube feeding, people are getting, if they're not able to eat orally, they get a tube through their nose. And the number one ingredients are maltodextrin, corn syrup solids, soy protein, and canola oil. So I would just ask questions. I would just, as a student, would say, hey, you know what? Is this the best way? Like, is this going to help someone who's been in a traumatic accident or cancer? Is this going to help them heal? And I was told, like, oh, Michelle, it's all about calorie. I was kind of pegged as this difficult dietetic student, but you're new and you're young. So you don't really, you're like, okay, well, maybe they're right. Maybe I don't know what I'm talking about. But as I became a dietitian, it just got worse. I saw patients, we literally called them frequent flyers because they would just come in with diabetes, and then they would come in with infections, and then they would come in and get amputations. And I remember when I worked in Colorado, I brought up a concern to my clinical coordinator. I said, look, I have too many, you get this huge caseload. I'm sure, you're very familiar as a doctor. I would tell my clinical director, I just don't even have time to make any changes. I don't have time to have even conversations with these patients. And she looked at me and said, well, are you charting? I was like, well, of course I'm charting. And she was like, okay. It was basically, the message was, are you checking the boxes? Are we getting insurance reimbursement? Yeah. But yeah, and then just to fast forward, but it wasn't until 2019 when I lost my own health that my entire world changed. So that's kind of when I shifted what I was doing as my own nutrition and as a professional. That is, my world changed.
Yeah, some of the things you're talking about are really resonating with me, because I remember, now, granted, I went through nutrition training, but going into med school, I myself was counting goldfish crackers to just try to stay within a lower fat, calorically appropriate diet. That's what I literally thought was, as long as I count, as long as I stay within these parameters, I'll be fine. And I remember when I was a resident on our GYN oncology service. So this is GYN cancer. So we're taking care of people with ovarian cancer, endometrial cancer, cervical cancer. And we know that breast, endometrial, and ovarian cancers are very much tied to hyperinsulinemia, hyperglycemia. I didn't know that at the time. But I remember in the middle of the night, I would get called for blood sugars on these post-op patients, right? They've just gone through this major surgery, and part of our protocol was to put them on a D5. So they're on a IV infusion, until
dextrose,
they start eating again of dextrose. And they would constantly have high blood sugars. And then the response from staff was like, we'll just start them on an insulin drip. And it made sense to me in like a type 1 diabetic patient, right? To be able to, we would do this on our pregnant patients, right? You want to make sure that there's this, constant balance of insulin and glucose, because they don't have a functioning pancreas. So you're kind of acting as, a pancreas, especially during a stressful time like childbirth. But I never understood in these post-op patients why we were allowing them to get so hyperglycemic. And it was, like the message was like, well, it's better than them being low. And I'm like, this can't be good for healing. And that was kind of like the first time that I was like, this just doesn't make sense. And I think this is around the time, Jason Fung was writing his book, the Obesity Code.
Yeah.
Re-looking at, this doesn't make sense why we would recommend 40-60% of calories from carbohydrates to people with insulin resistance. And so, and then of course it was, myself getting diagnosed with prediabetes and with a normal BMI, and somebody that was going to the gym and working out and still developing prediabetes. So it just resonates with me so many times as a learner. Sometimes they just want to tell you to shut up and stop asking questions, essentially, but that's like how we learn in medicine. Like, it's so much more of an art than it is a science sometimes. And it makes me think of like my little girls. My oldest daughter is totally me to a T. And it's constantly like the follow-up question, like, well, how does this happen? Or where did babies come from?
Yeah.
They like just the inquisitive mind. And I think a lot of us kind of, in this space are, you have to keep an open mind to it. It's just like the evolution of medicine. They say everything we learned in med school is almost outdated 4 years later. You constantly have to be evolving and looking at new things. And so I applaud you for it. It's scary sometimes to feel like the black sheep, to kind of stick your neck out and wonder, like, are we really, does this make sense? And so that's crazy. So you went through an eating disorder, as a child. Talk to us, because I find that a lot of people, and this is just kind of a personal anecdotal observation, but a lot of people kind of in the low carb space, many of them have history of disordered eating, not even just anorexia, but binge eating disorders, and just a very abnormal relationship with food. Can you kind of give us your insight on that, especially?
Yeah, absolutely. And I've actually done a few talks on these topics. So what I think happens, specifically with, eating disorders, at least my experience, is you're usually, obviously there's some type of trauma, there's some type of, something that happens in your life. And, once you become weight restored, you're kind of looking for that peace and that calm with food. And, from people that I've talked to dealing with binge eating disorder and other things, it's the same thing. And, I certainly was hopeful as a young person that if I just followed these rules, if I just did the standard American diet, if I ate my whole grains, if I ate my fruits and vegetables, I would be okay. I would feel better. I would be calm. And so, most eating disorder individuals are pretty type A. And so I did that, to a T. And I found that wasn't the case. My anxiety was through the roof. I was on lots of medication as a young person. I've spoke before about suicidal ideation. I engaged in a lot of self-harm. And, I know, at least for myself, and I guess, other people I've talked to too, it's kind of like, we're looking for how can we eat in a way to where we can just like eat and move on with our day. Because anybody listening to this that has an eating disorder, is actively engaging in an eating disorder, it dominates all of your thoughts. I literally felt like I was standing on the sideline of my own life. Often I would be with people, but I'd be thinking, did I eat too much? Did I not eat enough? What am I going to do? It's constantly like going to the grocery store was stressful. Like I would have anxiety attacks on the granola bar aisle. Like there's just too many choices. And so what I think, people are gravitating towards is how can we have calm, and nobody taught me as a dietitian, and I guess this kind of leads into more of my story, if you don't mind, I'll just jump into that real quick, and I'll be quick. In 2018, I was trying to qualify for the Olympic trials in the marathon. I was, you have to run a 2:48, under 2:48. I would run 2:54. And my body just wasn't recovering well from my runs. This time I'm eating 400 grams of carbohydrates a day. And two dietitians, sports dietitians, doctors, you just need to eat more calories, more carbs. Well, my performance fell off a cliff and my anxiety went high. I was getting cold sweats when I was running. And finally, I just ended up to where, I woke up in the middle of the night, everything was hurting, drove to 7-Eleven at 2 a.m, got ice, and I'm sitting in ice bath at 2 a.m. My wife came in and was like, oh, maybe we should do something differently. Yes, I'm done. I can't. Like I was physically, spiritually, mentally broken. And so at that moment, I literally remember thinking like, I knew intuitively that all these carbohydrates didn't make me feel good, but I had been told from the time I was 12, they're the base of the human diet. Through all my dietetics education, you have to have these, you need these. I was scared that if I didn't eat enough carbohydrates, my brain wouldn't work. We're told you need 120 grams for just brain function. But I also knew that my health was a mess. I think sometimes it takes people almost like a major event to decide like, okay, this clearly isn't working. So at that moment, I thought, all right, I'm never going to run again. This is stupid. I'm 36 at that point, too old for this. And I decided to follow a low carb ketogenic diet. I had heard, this can help with some mental health issues. Maybe I thought the protein might help with my muscles. And that's when I stumbled on the carnivore diet. And I literally remember thinking like, this is the dumbest thing I've ever heard. Like you have to have plants But this is what you said so beautifully earlier, is that we have to evolve. We have to ask questions, because I did some research and I reached out to people in the carnivore universe. And I'm like, well, you look happy. I'm not happy. You look healthy. I'm a mess. Tell me what you're doing. Talk to me. And I was shocked how many clinical trials we have, not on carnivore right now, but on low carbohydrate diets and diabetes, on anecdotal reports on low carbohydrate and mental health. You know, we have our first published case study on binge eating disorder and and ketogenic diets, you know, complete reversal.
Yeah. Can you highlight that study for people listening?
Yeah. And so I was like, okay, I gotta do this. Yeah. The study with ketogenic diets and binge eating disorder. So they took 3 different individuals and they looked at them. And these were people that had binge eating disorder like a lifetime. This wasn't, 20 plus years. All these people reported very high levels of depression, anxiety. All these people were morbidly obese, and they were put on a ketogenic diet and non-calorie restricted, so it wasn't like they were just eat until satiated. They were followed up in a clinic, and within a year, every single person had remission of symptoms. Every single person lost weight, and every single person, which I find maybe one of the most hopeful things, had statistically significant reduction in depression and anxiety symptoms. Mm-hmm. Because like I said, if you haven't experienced it, like if you don't know what it's like it literally takes over your life. And so to be able to engage in life, to be able to be present with your partner, your kids, whatever you're doing, I basically read that study and was like, these people got their life back. And and, with my own story, when I decided to adopt a low carb diet, first of all, my partner, my wife was not thrilled. She was like, oh, this is eating disorder. Don't do this. This is terrible. We thought about it. She cried. I felt terrible. But, she was like, all right, go ahead, try it. It probably won't work. 3 weeks into doing this, she sat me down and said, this is the best your anxiety has been in the 11 years that I've known you. And that was kind of the start of, we were both like, what is going on? And she was right. I was calm.
She noticed it before you did? Were you?
Yeah. I noticed that my body felt better. But I was just kind of attributed it to it. Oh, I'm not running. But she noticed, she really highlighted it. And that's when we were both like, okay, we got to figure out why. We can see this happening. But now it's time to reach out to people, dig in the research. And, I very naively thought that wow, everyone in the hospital I work in is going to be so excited. They're going to want to really implement this low carb diet with our patients, So
when you were eating 400 carbohydrates, what is the source of these carbohydrates?
Yeah. So most of it was very, it's a standard American. I ate a lot of brown rice, a lot of sweet potatoes, fruit. I certainly did have, those maltodextrin-based drinks after I ran, granola bars, some of the other higher carb, higher sugar.
Quite a bit of whole food carbohydrates.
Oh yeah. Yeah. No, this wasn't people are asking, oh, you're eating donuts and junk. It is no, I certainly had a dessert, but I would say 90% was whole food. So
yeah, I know it's a lot of people's argument is that when people go low carb, that they're just removing processed foods from the diet. They're just naturally calorie restricting, and that's where all the benefits come from. But I, don't agree with that. I personally had some postpartum depression, anxiety after my girls were born, and hypothyroidism, likely all just from my insulin resistance, because once that repaired, it all went away and got better. But I definitely think that people have better satiety. Patients tell me that I'm not as hungry. I don't have as many cravings, probably because they have better, blood sugar stability. And when you obviously weren't doing this to lose weight, you're doing it for other purposes. But I think there's so many other benefits that people don't realize. It's not the ketogenic diet, low carb therapies, are not just for seizures. They're not just for weight loss. The mental health applications, I think we're going to discover in the next 5 to 10 years that area is exploding. At Metabolic Health Summit, just, back in May, they had an entire metabolic psychiatry meeting prior to Metabolic Health Summit, where literally, people were reporting on schizophrenia, bipolar disorder, not just anxiety and depression, not just binge eating disorders,
amazing, incredible stories of people that have been on tons of antipsychotics that come with a boatload of side effects for these patients and really not great outcomes. And so this is just super exciting times.
Yeah. It was Dr. Chris Palmer that first talked to me about the concept of having insulin resistance in the brain, and you can have insulin resistance in the brain. I mean, we're just, and like you said, we are just discovering that this is such an amazing field to be in right now, that metabolic psychiatry, without any symptoms in the body. Like you can be like, and I potentially wonder, I mean, kind of how they look at that is, like you said, like with, like epilepsy, kids that have epilepsy, they have seizures, and so once you put them on the ketogenic diet, the seizures stop. The brain isn't utilizing glucose correctly, so you have seizures. But what the thought is, like, what if that is also causing other things? What if that is, causing some of these auditory or visual hallucinations, like with bipolar or with schizophrenia? What if this is causing some of the bipolar disorder? And people with those conditions, I worked in 2 different psychiatric facilities, and we can talk about how we feed those people. It breaks my heart. But that when we remove those carbohydrates and we're feeding their brains with, with fats, with ketones, all of a sudden we're seeing, like you said, we're seeing symptoms, we're seeing remission. We're seeing people who literally had to be in a locked facility start to function. Like, this is huge. If a pill did this, it would be on the market for thousands of dollars, but we're seeing this in a ketogenic diet. I mean, Alzheimer's, we have a clinical trial now that people with Alzheimer's had amazing, were able to do activities of daily life on a low carb ketogenic diet. It certainly would be my hypothesis that ketogenic diets are going to be very powerful for mental health. And I think we're just kind of discovering how that, and we see this over and over again anecdotally. I mean, you can look in the low carb community and people with OCD, people with, depression, like you said, even bipolar or schizophrenia are having a lot of improvement.
Yeah. And I think it's for just a regular person listening that maybe, doesn't have these disorders. I think it's still just this idea of metabolic flexibility and having the ability to have an alternative fuel source. I myself, go in and out of ketosis. It doesn't, I'm not trying to stay in this state all the time, especially being, an athlete like playing with targeted carbs or whatnot. But I think another cool area is exogenous ketones. What are the applications of ketone esters and ketone salts? And they started to talk a lot about that too at MHS. And right before this podcast, I took a shot of some ketone esters. Like when I need my brain to, when I'm doing something very like cerebral and I want to like concentrate and think, I use them as a tool for that. And I feel great when I'm in a fasted state too. I just like, my mind tends to work better. So these are just, tools that people can use. But if you get into a situation where you need therapeutic ketosis, like you get diagnosed with Alzheimer's or whatever it is, having that metabolic switch is amazing. We used to only think it was for epilepsy, and now there's so many other applications, which is super exciting. Okay. So tell me a little bit about, when you transition, you feel this improvement in anxiety, within 3 weeks. Talk about the transition though, being a runner, going from high carb to low carb, this period of keto adaptation. And I have people sometimes that ask, how long does that take? Like, God, my workouts feel like they suck. Like, what was that transition like for you?
Yeah. And so, initially when I adopted, I went full carnivore other than coffee, that first month, basically, like I did not anticipate running. Like I had kind of given up the idea. I was at peace with giving up running that first week. And if you recall, my wife was not super excited or supportive of this initially. That first week I had the worst headache literally in my life, like driving home from work, traffic, like just seeing the lights. I remember it just hurt, so I came home. She's like, how's that diet going? I was like, that's great. Leave me alone. So obviously I would do things a bit differently now, knowing what I know. I wasn't using electrolytes, but, about a little over a month into this, my wife appreciates solitude, solace. And she literally just kind of jokingly said, like, you should go for a run. You're bothered. I was just home more. And so, I put on my running shoes and ended up being able to run 8 miles. And I was like, whoa, could I run? Like, that kind of sparked the dream again. So when you are transitioning from a very high carbohydrate to a low carbohydrate diet, I always tell people, like, this is a stress on your body. Like it's ultimately, I think, especially for long distance and endurance running, it's going to be a really good thing, but you have to put your ego on a shelf for a minute. Like I remember being on a run when I first started, and this guy, he had to be 70, 75, like went charging past me. It's like, oh my gosh, grandpa's beating me, and I was very fortunate. I worked with Zach Bitter, who's an ultra runner. And he said, like, we have to keep volume and intensity very low. We've got to you're not going to be running very long. You're not going to be running very fast. And you have to give your body time. He said the minimum would be about 6 months until you feel really fat adapted. And he said, and obviously people are like, oh my God, 6 months. It's like, well, yeah, you're going to be more fat adapted 2 months than a month, obviously, whatever. But we did, probably at least 3-ish months of very easy running. And then, you start to put in some more intense stuff. And that's when you can also start to use carbohydrates strategically. I'm not anti-carbohydrate. I use carbohydrates for my running. But we use them around training, like what am I doing? If I'm doing a very intense run, I might even have carbohydrates before. If it's an easy run, I mostly do it fasted, but we'll do carbohydrates during, we'll do carbohydrates after. And then most of the rest of my day is protein and fat. I have a big race tomorrow, so it's kind of funny. I'm eating more carbohydrates the last couple of days than I normally do. But yeah, just really being prepared that this takes a while. Putting your ego on a shelf, like let's just hypothetically, let's say all your easy runs is a high carb person or 9-minute pace. You need to be ready for 10-minute pace, 10-30-minute pace. You need to be ready it will come back. I found, I could not do what I do now as a high carbohydrate athlete. Like my recovery went through the roof. I could do back-to-back long runs. My first ultra was a 6-hour race. I ran 44.63 miles in 6 hours. Wow. I, won the Tunnel Hill 50-mile last year. I'm running a 100-kilometer race tomorrow. Probably by the time this comes out, you'll get to see how it goes. It ultimately will be a very good thing. But, the problem I see, and this, is kind of a larger societal problem, is people want now. I want to feel better now. I don't like not feeling good for a week or 2 weeks. You have to buy into the process. And I think because I had been in so much pain and had felt so terrible, and I had seen how much better I'd felt. And I also was grateful, I had Zach and his testimony and support, that I was willing, like, okay, I don't care if this takes 6 months or a year or whatever. Like, I'm just grateful to be able to train again and to run again. Mm-hmm. So I would encourage, if anybody's really serious about it, I think it makes sense to get a low carb coach or someone who knows what they're doing. Because it's funny now in ultra races, like it's amazing. I see people taking so much food. I mean, people stop eating sandwiches. I'm like, this is a race. We gotta go, y'all. Like, I'm just able to take in a lot less carbohydrates because I can burn more fat for fuel, even at faster paces. That's the ultimate goal, right? Like, we want to be able to run fast, but be able to burn fat for fuel.
Yeah. For people that don't understand, you can only carry so much glucose and glycogen stored as a stored energy source in your body. So this is where that idea of carb loading, eating a bunch of pasta the night before an endurance race comes from. But on average, depending on how big or small you are and how big or small your liver is, you can carry about roughly 2,000 calories basically of glucose, glycogen in the liver and in the muscles. But fat, we have unlimited fat storage capacity. And then of course it can be dietary fat, it can be body fat. Runners obviously tend to be, pretty lean people, but then you can use targeted carbs. So I know Zach has talked on podcasts before using a certain number of grams every hour or mile or, whatever the madness to the science is. But, did you do any extra electrolyte supplementation or anything in that transition either?
I did. Well, initially I didn't really knew what I was doing. Yeah, I did. That the worst headache. Like, I will never forget that. I was like, why do traffic lights hurt my head? But yes, I do think you need to be careful, especially, it's just so much, there's so much transition in your body when your body's flushing out all that glucose and you're switching to burning, fat and more ketones. So a lot of salt, and they have some good, ketogenic electrolytes. I don't necessarily know if one's better than the other, but I use Perfect Keto. You just basically want to be getting, sodium, potassium, calcium, magnesium. People often ask, like, what's the right ratio? And honestly, I'm not sure anybody has that perfect idea. But I use quite a bit now, especially since I run, I use the LMNT, which is, potassium, magnesium. And like I said, I use the Perfect Keto, which has a couple other things. And I usually use Calm at night, the one that has calcium, magnesium, vitamin C, boron. And that is basically what I did. But I feel like, especially in that initial transition period, I would encourage people to lean a little heavy on the electrolytes. Your body will flush out, but you don't need. Obviously, if you have a medical condition, you should, check in with your doctor. But I've seen too many people kind of underdo it and have headaches and body aches, which I think can be much probably alleviated a lot better if you. But yeah, and I mean, you made a good point too about running. But even really lean runners, I found this interesting. People with 6 to 8% body fat, which is super lean. Male athletes, even those people have up to 80,000 calories of body fat. It's just when we get that insulin response, when we take in carbohydrates, we really suppress our body's ability to burn fat for fuel. So yeah.
Well, and for us normal runners, I hate running. I've done 2 half marathons, but I remember,
awesome.
I remember at one of my races looking at the people running the marathon, and although, you have a picture like in your brain, like Zach Bitter, super lean, kind of thin guy with not a ton of muscle mass. I remember looking at some of these runners and I'm like, they don't even look like they're in shape. I'm like, I mean, I applaud them. I'm like, they're running a marathon. I'm not. Sure. But I tried to run to like get my baby weight off. I mean, that's why I signed up for these 2 races, but it was just this total confirmation that you cannot outrun a bad diet. I mean, these people are running hours and miles a day. And I mean, they had visceral fat, they had calories, they had, it's just like.
You nailed it. Well, I can't tell you how many women I worked with that are like, I'm training for a marathon and I can't lose weight. And so that if you ever need something to throw like calories in, calories out the window, everything in science should say like, hey, you're running 30, 40, 50 miles a week, you should lose weight. But if you think about how we structure diets for people who are running marathons, it's basically like, okay, you run and then you have carbs, and then you have, you have a bagel in the morning, you have a sandwich and a cookie in the afternoon, you have pasta, carbs. You're constantly, getting an insulin response. And that's such a powerful concept. I try to hammer that home in my book, that insulin suppresses your body's ability to burn fat for fuel, and once again, that doesn't mean you should never have carbohydrates, but for someone trying to lose weight, telling them that, suppress body fat burning, suppress it all throughout the day. And then you're like, I don't know why I can't lose weight. It's like, you're working against your hormones.
Mm-hmm. Yeah. And I mean, when you think, even 100 years ago, just the daily activity of humans is so much different. I mean, we sit at desks all day. You can get Uber Eats. I mean, they will bring the food to you. We don't have to physically expend a lot of energy to find food and calories these days. And so, I think all exercise is great, but just increasing just activity in your day and controlling what you eat is the one most powerful thing you can do in the shortest amount of time to change your health, just in my opinion. I mean, because most people are eating multiple times per day. So this is like something we do daily, multiple times, and just starting to make some small changes is going to have a huge impact. And I think when people transition, I've kind of changed my view a little bit. Certainly when I transitioned to the ketogenic diet, it was like full bore. It was like standard American, hundreds and hundreds of carbs to like, okay, I'm eating less than 30 every single day. And that transition can be brutal because, like you said, it's stressful. So you get this noradrenaline response, you get a cortisol response. It further depletes your sodium and potassium and electrolytes. And so it's so important to supplement. But I think that an approach I've kind of changed is if a patient's eating 400 carbs, we're going to go to 200 for this week. And let's see how you do, on 200. And then let's cut it by 50% each week until we get you to a place where you're feeling, better, you're feeling confident. And, if they don't need therapeutic ketosis, I mean, if it's not a child that needs therapeutic ketosis by tomorrow, they're going to seize. I think it's a better approach. Like what can you cut out? Obviously the processed carbs, easy things to get rid of quickly, because they tend to have a lot of other things in them that are probably, not helping you. But dang, they're easy to find and they're cheap and they taste good and
they're everywhere. That's another, that's a problem, it's a big problem. And I like that. I appreciate that. And I found through, some of the coaching I do is I really feel like you have to know yourself. I have people that say like, I'm ready. I want to go all in. I've got support. Let's do it. It's like, all right, cool. But then if you're like, I'm not ready, a lot of people, it's a big deal changing how you eat. And it's not just switching out, okay, well, instead of rice, I'm having an avocado. It's also dealing with often, people use food as coping mechanisms. It's dealing with emotions. It's changing your behaviors. It's a big deal. So I appreciate that as well. And I appreciate that idea. I think a lot of people get overwhelmed too with like, I just am not ready to, go all in or give everything up. So it's like, yeah, we can baby step you. Like, that's fine. I always say there's no gold medals for like doing this quickly or not quickly, right? The whole goal is to, ultimately be as healthy as a human as you possibly can, physically and mentally. And it's interesting to me how, as a nation, we've allowed so much processed food. Like, we know, like, this is no secret that, all these carbohydrates, all these oils, they are contributing to poor health, and they are everywhere, and a lot of people deal with food addiction, just literally struggle with these processed carbohydrates. And we know they override our brain and body's ability to moderate them. Mm-hmm. And, but it's like, you can't even drive down the road without seeing a billboard. I was just trying to check baseball scores last night and a Velveeta ad popped up, they're everywhere. So it's hard. You made a great point. You have to actively, like, this will not happen passively. You have to actively plan to eat in a different way if you want to be a healthy human than most Americans. And you have to actively plan to move in a different way, because it's not just going to magically happen, So you have to kind of overcome our society, really. It's unfortunate it has to be that way.
And I think the thing that people need to hear too is it can look differently for everybody. So like when we say low carb or ketogenic, there's plant-based and vegan ketogenic diets, there's carnivore diets, there's just low glycemic index, there's actual therapeutic ketosis, and it could be different for you and I and anybody listening. You and I think agree on kind of this more nutrient dense animal food, carnivore type, low carb diet. Can you tell us how you kind of settled on that for yourself?
Sure.
And why you think that is a superior approach for you?
Yeah. So, the concept of bioavailability wasn't really taught to me as a dietitian. And what that is how much of a nutrient can my body actually utilize and absorb? So I always use the example of like steak versus spinach. They both have iron. Steak has that heme iron, which is better absorbed. Spinach has the non-heme iron. And we're always taught as dietitians, like, oh, it doesn't really matter. You just have to eat more spinach. But we know that's not true. We know that the human body actually utilizes and absorbs certain nutrients better than others. So I always say, like, it doesn't, your body can only absorb about 1.7% of the iron in spinach. And that's not on labels, that would be the equivalent of like, if I wrote you a check for $1,000 and you're super excited, and then you go to cash it and you're like, oh, she only has $17 in her bank account. It doesn't matter what the check says. It matters what the funds are, And so what I had found throughout my adolescent adult life was I often struggled with acne. I struggled with anemia, and I did not know that a lot of these plant foods, that the absorbable nutrition in them was relatively poor. Also, they have things that potentially prevent the nutrition from being absorbed. Example is phytic acid. A lot of grains, nuts, and things like that have phytates or phytic acid. So when you eat those, they actually bind to iron, And so, although I was eating meat as a younger human, I think the fact that I ate so much oatmeal, so much grains, it was potentially binding to that, to the iron that was in there and preventing my body from absorbing it. So what I found, and also there's just so many other things that are not in plants. There is no K2, there is no performed vitamin A. Your body has to go through a different process. And we know a scientific report about 45% of people don't have the gene to take the vegetable, the carotene, vitamin A, to actually utilize vitamin A. Yeah, I think I might be too, because I had so much skin issues, And so what we know, this isn't debatable, is that animal nutrition is more absorbable for the human body. And, if somebody's like, I absolutely am going to be vegan, you can't change my mind, then my advice to that human would be, you need to be very careful about supplementation and about those different things. But I have just found that, my life and my health changed when I really prioritized getting, a lot of the animal protein, because it's not just protein, it's creatine, it's carnitine, it's carnosine, it's B12, it's folate, it's all those different cofactors that work together to really help your body and brain function. So that's what I found for me. And that's what I've seen work for quite well for a lot of people.
Yeah. It's funny. You mentioned creatine, like in the athletic world, probably one supplement that 100% of people would agree is very good for performance and being athletic and putting on lean body mass is creatine. It's been well studied, hundreds and hundreds of studies. Well, where do you get that? Meat.
Steak, yeah, meat.
Somebody asked me one time, do you supplement with creatine? I was like, actually, I don't. I'm like, I just eat a lot of meat. I'm not a huge fan of supplementation, just like blanket supplementation.
Sure.
I see patients come in with backpacks full of, and half the time they've got the same thing in 5 of these bottles. Yeah. And, if people really knew the supplement world, there's no guarantee that that's what's actually in it. Yes. There's different sources of these vitamins. Some are more bioavailable, some are not, some are synthetic forms. It is, the supplement world, and these things are expensive.
Supplement world is the wild, wild west. You and I could start, most people don't know that. You and I could start like Jamie and Michelle's calcium company, and it legally doesn't have to have any calcium in it.
No. Yeah. Yeah. And the amount of money, the monetary stress, that all that supplementation, the time and cognition it takes to remember to take it, and it's overwhelming. And that's my bigger concern with kind of this plant-based diet, push right now. And I'm seeing it in medicine and amongst OBGYNs, and it's not good for fertility. It's not good for pregnancy. To eat a diet that requires extra supplementation of things like B12 and choline and vitamin D is concerning to me. We should be able to get these things, from our food. And
you can.
I fear that, I fear basically that the scaring people away from eating red meat and nutrient dense animal foods and being quote unquote, plant-based will really honestly drive more people into eating more processed carbohydrates.
It does. Yeah, I apologize. I don't mean to interrupt you. I get so passionate about this topic. It's so hard.
Yeah.
Yeah. Well, and I think what they've done is, like you said, they've scared people. They said these foods cause disease. And then you have another side of it saying these foods are bad for the planet. These foods hurt animals. And if you you got to pull back the curtains. This is why people have to ask questions and say, oh, interesting. Tell me more. Tell me more. How do these foods cause disease? Because we now have meta-analysis that say red meat does not cause disease. There's no evidence that says it causes causes heart disease, saturated fat in red meat. And then if you also just you don't even need a meta-analysis. Like if you just think about evolution, if that was true, humans wouldn't have survived. Every human throughout evolution was eating the megafauna. They would all have heart disease or they wouldn't have survived. Then you have people saying meat causes diabetes. That's just, I could go down that rabbit hole.
The new attack this week is this article that multiple people have sent me that meat causes depression. There was
I saw that.
Particular amino acid that if people ate more of this particular amino acid, they had higher rates of depression. And I'm like, so you mean to tell me that amino acids, which are essential for life, cause depression? Okay. All right. That's the trouble with a lot of these studies is, correlation doesn't mean causation. It's hard for regular people to, that don't look at research to understand these types of things. And, it's sad how they just get, circled around the internet and around the world. And, people are just reading headlines, essentially. So scary.
Absolutely.
Time. Okay.
It really is. Yeah, it really is. We know too, that it's just like when you pull, like I said, when you pull back the curtains, you're just using common sense. Like, is this tofu or this thing that's grown in a lab, is that actually going to be better for my body? Like, just thinking about it from or this humanely raised animal. And that's why I'm glad we have regenerative agriculture, things like white oak pastures. And that's where I really hope that the future of our food is coming from, using both plants and animals to sequester carbon into the soil, make sure we're raising animals with excellent animal husbandry, doing things humanely. Because honestly, there's nothing humane about, a lot of GMO crops or, a lot of animals. I think statistically it's like 7.9 billion animals die for vegan, for crops. So, But we could go down that rabbit hole some other time.
Yeah. So I have a future guest coming up. You guys will be talking about, land regeneration, regenerative farming, the dangers of monocropping, the true story behind greenhouse gas emissions when your avocados are shipped all over the world so that you can have them 365 days a year. So, I eat a very heavy meat-based diet, but we just put a raised garden in our backyard. If you really want to help the environment, you should start raising your own food. That's really honestly the best solution, get some chickens and start a garden and
and support your farmer if you can, if you have a local farmer, it's the way to go.
Yeah, we buy our cows half a cow at a time, and keep it in the freezer. And with the meat prices and things that are happening, that's the best way to protect our family from inflation. And we're very grateful that we can do that. So, and it comes from a local farm, so we can go see the animals, and we know how they're raised and watch them grazing on the grass. I'm glad my cows like to eat the plants.
Yes, it's great.
Okay, so we end every podcast with something called the semen analysis. And today I pulled a study that it's scary, actually, you guys. So it's called Pregnancy Outcomes in Young Women with Youth Onset Type 2 Diabetes. It's the Today study. And it's been looked at. If you just Google Today study, you'll find lots of different assessments of this data and this cohort of women that they followed. And they basically followed these women for 15 years. There was 260 pregnancies amongst 141 women. The average age of these women was 21 years old. So these are not old people. These are very young women. The average BMI of these people was 35. And the average duration of their diabetes was 8 years, which is a long, when you do that math, right? A 21-year-old that's pregnant that's had diabetes for 8 years, that was diagnosed at an extremely young age, which is scary because, and I'm getting slightly off the topic of the study, but during the COVID pandemic, the rates of type 2 diabetes diagnosed in our children was more than 100% increase. It's very scary what's happening with our children. And so that's why I want to highlight this study, because women that come to OBGYNs healthy before their pregnancy will improve not only their health outcomes, but the health outcomes for their children and their children's children. And we're talking like generational health impacts here. Here's one scary fact from this Today study. Contraception use prior to pregnancy was at 13%. So here you have an obese young woman with type 2 diabetes that is not using any sort of contraception. So the risk of pregnancy is very high, but complications during their pregnancy was 65%. So that's 2 out of 3 women are going to have a major complication. Pregnancy loss was 1 in 4, 25% risk of losing their pregnancy. Preterm birth rate, 32.6%, 1 in 3 chance they're going to deliver preterm. And a lot of these women ended up developing chronic hypertension, so high blood pressure. 25% of them had problems with their kidneys, renal disease related to their diabetes. 10% of their babies were small for gestational age. Almost 30% of their babies were large for gestational age. It's really scary what hyperinsulinemia and hyperglycemia can do to us, to our offspring, and like I said, for generations to come. So if you don't know if you have insulin resistance, I just did a reel about this today. You can go to your doctor. You can ask to have your fasting glucose and insulin checked. You can ask for your A1C to be checked. You can ask for a lipid panel to be checked, not because I care what your LDL is, but your triglyceride to HDL ratio is another marker for insulin resistance. You want to know what these numbers are on an annual basis, and it's never too early to know your numbers. So even if you're like a teenager listening, maybe this is something to bring up with your, ask your parents, talk to your pediatrician. If you care about your health, you need to know what these numbers are, because the honest truth is that insulin resistance doesn't have a lot of symptoms. We say symptoms like they're usually very vague. Maybe you've got headaches, maybe you've got fatigue, maybe you have anxiety, like Michelle. There can be very overt signs and symptoms, like a darkening of the folds under the arms or in the folds of the thighs. Maybe you have a lot of skin tags, maybe you have acne. These can all be problems that there's metabolic, signs and symptoms that there's metabolic dysfunction underneath. But the truth is you don't know until you check your numbers. So I just want to highlight this study and how scary it is that it's happening younger and younger and younger generations.
Wow, that's how young is the youngest person that you've seen with diabetes? Do you know?
Well, in OBGYN world, thankfully we don't. Obviously they're going to be diagnosed by internists and pediatricians, but I have seen a lot of teenage patients come to me with problems with their period, heavy periods, PCOS, and I've had a 13-year-old in my clinic with type 2 diabetes. Yeah. I myself have diagnosed some of these patients. I mean, they weren't even, screened by their pediatrician. And I'm like, they're, morbid obesity, they have all the risk factors, and
sure.
I've diagnosed it a couple of times, but it's scary, how young it's happening, and if we don't catch it and do something. And I have another podcast you guys can go back and listen to with another pediatrician that deals with obesity medicine, but she talked a lot about just as a family, how to eat. And it's, somebody's buying the food, somebody's bringing it in. And a lot of times it's, mom and dad have the same health problems, and it's just getting passed down from generation to generation. And at some point somebody has to break the cycle, that's the honest truth. So if you're a young person listening, advocate for yourself and find out what your numbers are. And somebody has to be the first one to speak up and take some ownership and accountability. That's really honestly our only solution for, where America's going and where Western medicine is going, is us as individuals have to start being kind of personally accountable for our health.
Oh my gosh, I could not have said it better. I feel like you have to be you have to be okay to being different, because the world right now, I mean, 88% of Americans have some type of metabolic dysfunction, whether that be, high blood sugar. And if you go into your doctor, even if you have obesity or anxiety, they're likely not going to say, okay, we're going to run fasting insulin. You need to ask for this. You need to say, I want to know these numbers. I want to follow these numbers. I need to know what my triglycerides to HDL are. I want to know this, because knowledge is power. And like you said, whether you're a teenager, whether you're an adult, the decisions you make ultimately are going to affect people down the road. How I've changed my health, obviously it makes a huge impact in my life, but it affects everyone around me. I'm a better partner. I'm a better worker. And like you said, if you're going to have children, this will impact your children directly. So really, taking that message to heart and being cognizant of, I need to make sure I'm doing everything I can to be as healthy as a human. And I asked you that question about how old. The youngest person I saw in the clinic was 8 that had type 2 diabetes. So we're seeing it younger and younger for sure.
Yeah. I don't usually see them until they start, menstruating, but there's younger and younger people being diagnosed with insulin resistance and diabetes. And when you're talking about it at that, it's one thing, right, for your grandma to be diagnosed very late in life. And some of that insulin resistance is kind of age related and cellular senescence. But at a young age, that is lifestyle. That is toxic fats and seed oils and sugar and flour in the diet. And thankfully, though, it can be reversed, and it can actually be reversed very quickly. So that's the other thing, for anybody listening, is there's something you can do about it. So I applaud everything you're doing, Michelle. And
thank you.
Tell people how they can find you, how they can find your book.
Yeah, absolutely. So I am most active on Instagram at Run, Eat, Meet, Repeat. You can get my book on Amazon, The Dietitian's Dilemma. I have a paperback, I have the ebook, and I have the Audible. And I also have a website, thedietitiansdilemma.net. Feel free to contact me with any questions or if you're interested in coaching.
Amazing. Well, thanks everybody for listening to the Fit and Fabulous podcast. Make sure you share this podcast with somebody that might find it interesting or helpful. Maybe it'll make a huge impact in their life. And every time you guys like and download and leave us reviews on Apple Podcasts, on YouTube, whatever platform you're listening on, it really helps us out. So thank you guys, and we'll see you on the next episode.
Thank you.